Welcome back. We've got our final conversation for wrap up. Talking earlier about heart disease. Don't worry, it's not related to Val's Day and heartbreak and all that is. So I think Dr. SHERIF Okyeere, as always, from Army Scientific, has joined us here for the conversation. Today we'll do just an introduction to it, and then next we will get into it proper. Doc, good morning and welcome.
Morning.
Yes, not connected. Anyway, heart disease. You were telling me earlier that it's a very broad thing.
Yes.
How broad is it? What are the components that makes it, a really broad topic?
Yes. So I think first and foremost we need to actually understand what the heart is.
Okay.
In the first place, before we can delve into some of the diseases that affects the heart. You understand? And there are numerous, disease conditions that affects the heart. Myocardial infarction to myocarditis to heart attack, cardiac arrest, and all those conditions. These are all conditions that affects the heart. But first and foremost, the heart. A heart is an organ that anatomically is located at the chest level, just above the diaphragm. Okay. It is more tilted to the left side of the chest than to the right. Its size is about between 300 and 350 grams. So just like a two fists put together like that. Its main purpose is to circulate blood or circulate blood in the body. So okay. The heart actually will receive blood after circulation. Blood will move into the lungs for the blood to be oxygenated, okay. Because after circulation there's deoxygenation. So after oxygenation, blood moves back into the heart, and then it moves back into circulation. So this is what happens within the heart every minute, every second. You understand? And when you look at the heart, we have 4 chambers. Yes, so the heart is being divided into 4 chambers. We have if you cut in between cross-sectional like that, we have the upper chambers, which is the atria. One is atrium. So we have the right atrium and the left atrium. And then also we have the lower chambers, which is the ventricles. So the right ventricles and the left ventricles. So yes, so blood that has moved into circulation will come through the right atrium. It moves into the right ventricles, okay. Which will move back into the lungs for oxygenation. It comes through the left atrium back to the left ventricles. After left ventricles, that is when blood moves into circulation. So this is the cycle. That is how the heart actually works. So all these things that we are mentioning happens within a minute. So the heart keeps on working. And the heart is one of the organs that starts working right from conception. Okay. So if a woman is pregnant and you take an ultrasound, the first organ you're probably to see is the heart. You see it, moving like that, and it works throughout our lifestyle. You understand? Until you die, your heart always works, even when you are sleeping. It doesn't have rest. So this is what goes on in the heart every minute, every second. You understand? And there are so many conditions that will actually happen within the heart. Just as I mentioned earlier, heart attack, which is very common. It's in America, I think it's the #1 cause of death. You understand? In every 30 minutes, someone dies out of heart attack.
Wow, that's crazy.
Yes, so it is very, very serious medical condition. So with time, we'll probably might not be able to delve into some of these things. But when you look at heart attack or heart diseases, some of the risk factors that we can, you know, talk about even before we delve into it is, first and foremost, people with underlying conditions. You understand? Yes. So there are a lot of underlying conditions that could predispose someone in getting, you know, heart attack. So I think because of time, you know, so maybe next week we'll take our time and move into some of these details, some of the things that could lead to some of these heart diseases and all those things. But before we go, Amen Scientific Herbal and Alternative Medical Hospital is still doing the free health screening. So if you are watching us and you're having any heart-related condition, I will entreat you to also come to Amen Scientific Herbal and Alternative Medical Hospital to get yourself checked during this period of free health screening that we are
so free health screening happening at Amen Scientific. You see the numbers on your screen. Call and ask for direction. Call and go seek assistance with respect to your health. And but Doc, I want to ask, today is Val's Day.
Yes.
I'm not predicting, I'm not prophesying, but there'll be heartbreaks. That one will cause the heartbreaks. Anyway, thank you very much, Dr. SHERIF Okyeere, for coming through from Amen Scientific. And so there you have the numbers on your screen. Call them, locate them at Domestic Flats, and also that is a Clagon near the other bridge. Someone must be like, does it happen? Because the heartbreak will make you cry and you had to stop beating. Then your chest they pay.
It's quite different from what we are discussing, though. But of course, if you know, during Valentine and when your heart is broken, you know, there could be some enzymes within the heart that could, you know, there will be derangement and all those things. But it's totally different from the heart disease that we are talking about.
Enzymes or whatever, you know, the movie. So please be careful. All right, so that's it for the show today. Happy Valentine's Day to all of you.